Hello, this is Stacy Scroggins, and I'm presenting my quality improvement project for Caring Hands Healthcare Center, Patient Flow Response to the COVID-19 Pandemic. This is my final project for quality improvement in healthcare for A.T. Still University. I would like to start off by discussing the system that is affected by this problem, and that is Caring Hands Healthcare Center. Caring Hands is a federally qualified health center, or an FQHC, located in McAlester, Oklahoma. Caring Hands provides primary care services to pediatric and adult patients, as well as some specialty services. We also have urgent and same-day appointments as needed. There are 3 clinic locations in Pittsburg County, Oklahoma. Caring Hands has been recognized as a patient-centered medical home and focuses on preventative medicine as well. The problem is related to the novel coronavirus, or the SARS-CoV-2, which causes COVID-19. COVID-19 has caused a global pandemic, which was declared by the World Health Organization on March 11th, 2020. And due to the pandemic, this has caused major disruption worldwide of everyone's lives, including healthcare organizations. The Centers for Disease Control, or the CDC, recommends that healthcare facilities minimize patient exposure to COVID-19. And high-risk patients are those that are older adults and those patients with comorbid chronic disease, including diabetes and heart and lung disease. And the problem is that the clinic needs to keep non-COVID-19 patients from being exposed while they are in the clinic for routine care. To more completely evaluate the problem and see where some of the underlying factors that contribute to the problem are located, this fishbone diagram can assist us with that. The problem statement is located on the right side of the slide at the point of the arrow. And the problem statement is clinic staff and well or routine visit patients are exposed to sick or possible COVID-19 patients in the waiting room and the clinic areas during the appointment. And the process that occurs is that Caring Hands has one entry and one exit for patients and clinic visitors, as well as family members of patients that present. And they all meet, or they all gather together there in one common waiting room, and they all check in and check out of one reception desk. The people that this affects, of course, are the patients presenting, as well as any visitors and clinic staff. And the environment is one that the waiting area is considered to be a public space, and so anyone and everyone is welcome there. The patients wait there until they are called back to triage and to the exam room. The dental patients also pass through this on the way to the dental office. The policy that affects this problem is that patients are only examined in the exam rooms inside the clinic for face-to-face visits. There are no alternative methods or places designated that patient exams can take place. In addressing this problem, the Plan, Do, Study Act is a tool which can help implement change within the organization. And you can see that this is a perpetual process, an ongoing process, and the current pandemic situation is also constantly evolving. So on the upper right-hand corner is the plan stage, and in order to implement a change to prevent patients from being exposed, we need to establish a team in order to tackle this problem. And the team needs to figure out a way that we can modify the patient flow to provide the appropriate level of care to patients, minimize infection risk, and protect healthcare personnel and non-COVID-19 patients from infection. It's also important that we apply the current CDC recommendations regarding the clinic flow. And we can do this through accomplishing a modified triage protocol, modify the physical environment, such as the waiting area, in order to distance the patients and keep them from sitting or waiting too close together. Also, it's important that we modify the electronic health record for tracking purposes that we can document where the patients are examined. And at the end of the brief trial period, we can look at some of the data, and especially the data on where the patients are examined. And the goal is to have 100% isolation of COVID-19 patients from non-COVID-19 patients. And this can be possible through keeping a log of the patients, the visitors, and healthcare personnel, including the temperatures upon entrance to the clinic, and review the patient evaluation and exam locations. The treatment team will meet weekly to discuss any potential problems and changes, and they will have ongoing communication through daily emails, keeping all team members up to date as this process is ongoing and evolving. They will also present at the monthly staff meeting any changes and some of the outcome from some of the changes that they have implemented. So this algorithm is a process map, and it shows what happens or what will follow whenever a patient presents to the clinic and comes into the front door. You can see that once a patient enters, they will be screened. They will ask to wear a mask, and if they answer yes to any of the questions by the screener, then they will follow the protocol there on the left side of the screen. And if they answer no, then they will follow the flow on the right side of the screen. And this is helpful for all departments, including reception, medical, any of the dental, behavioral health, anyone that's directly involved in patient care, or anyone that's involved with the flow of the clinic. The patient flow quality improvement team is going to be composed of a representative from each department, and each department team member is responsible for educating their staff members. And the medical director will decide the team leader, and like I mentioned before, they will communicate with daily team updates through email and will meet weekly. Any urgent or emergent problems can be implemented directly by the team leader with approval from the medical director. And at the monthly staff meeting, the team will provide updates and changes. In review, the key changes that will be implemented per the CDC guidelines are that the patient and visitors will be greeted and screened immediately upon entering the front door, and everyone entering the clinic ages 2 and over will wear a mask while they are inside the clinic. Any patients that have fever and any respiratory symptoms will be isolated from the symptom-free patients and visitors, and they will be seen and evaluated in the car. Modified the waiting areas, provide visual cues and signs upon entering the clinic and along the walls. We'll keep a log of the patients and visitors, and the clinic employees will be educated in these new procedures by the improvement team. This is a list of the references that I used in order to make up this plan, and I thank you so much for listening.